Okay, we'll start now. Fine. Welcome to ANU Indonesia Project Global Seminar. My name is Arianto Patundru. I'm hosting this with Nurkamala Mulyani. We acknowledge the first Australians and pay our respect to elders past, present, and emerging. We are grateful for the support from the Australian National University and the Australian Department of Foreign Affairs and Trade. Today, we are going to talk about the socio-economic impact of COVID-19 in Indonesia based on a large-scale household survey as a collaboration among UNICEF, UNDP, Prospera, and SMERU Research Institute. We have invited the main contributors of the report, Michelle, Andrina, and Asep Suryahadi from SMERU, Ratnawati Muyanto from UNICEF, Rima, Prima, Artha from UNDP, and Della Temenggung from Prospera. We are also very grateful to have Bapak Hidayat Amir, the head of the Center for Macroeconomic Policy at the Fiscal Policy Office, Ministry of Finance, Indonesia, to give some remarks. We will have question and answer session after the talks, but if you want, you can write your question anytime on the question and answer box, not on the chat box, and we will attend to them in the Q&A session. Please also kindly fill a little polling when it appears on your screen. We need this to improve our series. So welcome everyone again. Thank you for sharing your report here to this webinar. Let me start first by inviting Michelle Andrina to give us some overview of the survey and the findings. So over to you, Michelle.
Yeah, thank you so much, Pak Aco. I will share my screen and allow me to also stop my video, Pak, because there are also Zoom session in my house at the same time. Okay. Is it already?
Yep.
Can we see it? Yeah. So good morning, Bapak Ibu, ladies and gentlemen. Actually, when we first launched our report back in March 2021, we had not anticipated that our findings on the socio-economic impacts of the pandemic would be relevant to guide the relief effort. We thought we would be discussing this work in the context of recovery from the pandemic, and yet here we are now facing a second wave of the pandemic in Indonesia, and at a point where the government again has had to implement another large-scale mobility restriction to curb the spread of the Delta variant. So many lives have been lost and also livelihood already disrupted. On behalf of the study team, I will present the key findings of our survey. We hope that this finding will prompt a greater focus on household, children, and also vulnerable groups in the relief and recovery effort. So just to give you a background, this study is a product of collaboration among UNICEF, UNDP, Prospera, and also the SMERU Research Institute, with a close oversight and direction from the Government of Indonesia partners, especially the Ministry of Finance and the Statistics of Indonesia, or BPS. The data was collected between October and November 2020, it involving more than 12,000 households across all provinces in Indonesia, which is to represent all households at the national level. This study remains the largest on the impact of COVID in Indonesia, and it focuses particularly on children, women, and also people with disability. It relies on face-to-face interview with the same household that were previously interviewed by Statistics Indonesia in the beginning of 2019. Here, I will highlight some of the main findings of the study. First, with the Delta variant, we know that children now are at a greater risk of being infected by the virus, and they are also face multidimensional challenges. There are 4 dimensions that I want to highlight. The first one is the household income. Around 3/4 of households with children, they have experienced a reduction in income, and children as dependents, they are among those at greatest risk of seeing their living standard and personal well-being decline. Second, as we have learned during this period of mass school closure, The remote learning, it relies on internet, device, and parental support. But we found that 57% of households with children, they do not have reliable internet connection. 30% also do not have the necessary device. And rural and poorer households, they face more problems. And as a result, over 60% parents are concerned about learning loss due to disruption in their children's education. Health services have also been disrupted. 13% of households with children under 5, they reported that they could not access immunization service, in which the percentage is quite high in rural. And while the number might be seemingly small, all children need routine immunization for healthier growth and development. We also found that 27% of households with pregnant women, they say they did not visit health facilities for routine pregnancy-related checkup. Fear of contracting the virus was the main reason for both. And additionally, we also found that the school closure, social isolation combined with economic uncertainty, they also put children in other risks. 45% of households, they reported behavioral challenges among their children. And we also found that there appear to be a rise in children who are working to support their families. 7% of households say they have working children, 2.5 of whom had started to work since the pandemic began. And our analysis also corroborate the view that mothers' work burden has increased substantially due to closure of school, daycare, and also kindergarten. We find that 71.5% of households with children of schooling age, they are interviewed in the survey, they are helped by their mothers during the distant learning, and this is 3 times more than the fathers. We also found out that half of the women, they also involved in paid work. This is indicative of a large structural imbalance among vast majority of households in Indonesia. The survey results also show that a slightly higher proportion of households with persons with disability, they have experienced income loss. This is a context where the workforce participation of households with disability was actually already low even prior to the pandemic. Meanwhile, we also found that 37% of households with a child with disability, they said they have not been able to access therapy and other health services that they need because of disruption to the services and also fear of contracting the virus and also another problem with money as it reflected in this quotation here. School closure, social isolation, and combined with economic uncertainties, they are fueling another silent pandemic, as you can see from the figure presented on this slide regarding the mental health. The government of Indonesia, they also already rolled a massive fiscal stimulus packages through the National Economic Recovery Program, or PEN program, to cushion the affected households at the time of the data collection. So in the next half of the survey, I will show you why the assistance is needed and about the area to improve. We think that this could serve as a lesson for responding to the current pace of the pandemic. So here we found that the impact of the COVID on household finance, it has been severe and is likely to continue in 2021 with the new large-scale social restriction. First, we found that 74% of households, they were earning significantly less than they were in January 2020. Households across all expenditure groups experienced this, from poorest to the richest. But we also found that the percentage is quite higher with households with members with disability, children, and those in urban areas. Our simulation, which found that a new generation of households that were previously well off, they in quintile 3 or 4, they are now poorer and also vulnerable. Second, we also found that half of households in Indonesia, they have no saving upon to fall back on, and as a result, 27% were selling or pawning their asset. A quarter have to borrow money informally. And among the households with existing debts, 40% said they were failing to make regular repayment. Third, we also find that a small portion of primary earners, they had switched jobs as a result of the pandemic. Yet, almost half of them switched from formal to informal employment. And we also found that up to 70% of the primary earners, they were working completely from their workplaces. including those who were living in households with elderly, school-aged children, and people with disability. And this raised concern over virus transmission, their ability to support children with remote learning, and also to provide care for those who may fall ill. As the graph on the right-hand side shows, we also found that the work suspension rates were in line with the strictness of the public health measures. We also look into the question of whether the COVID pandemic affecting the household food insecurity. So we use the VS or the Food Insecurity Experience Scale developed by the FAO. And based on the Statistic Indonesia calculation in 2019, there are 5.4% of households that has moderate and severe food insecurity. But in the 2020 joint survey, we collaborated with BPS to do the estimates, and we found that this number has increased to over twofold, so 11.7%. Household with member with disability, female-headed household in the bottom 40%, and household with children, they have the higher prevalence of food insecurity. We also found evidence that mobility restriction, it correlates with the rise in the mild food insecurity. Here too, the impact, it's higher among poorer household and household with children. Then for a positive one, the positive finding from our study is that the social assistant, it reached many people in need at the time of the survey. Most households, it had received at least one form of social assistance, be it in cash or in kind one. The poorest household, they received the most assistance. And half of the total household in Indonesia, 51%, they received the cash assistance. However, more than 1/3 of households in the bottom 40%, they had not received cash assistance in October and November 2020. And this includes poor households with children and living in urban area. So initially, we were surprised that so many households in quintile 4 and 5 already received the social assistance. But when we look more closely, we found that even in 2019, only households in the top 20% or in the quintile 5 in our sample that were earning enough to sustain a decent standard of living before the pandemic. And the household in the remaining 80% of the distribution or quintile 1 to 4, they were earning too little to sustain a decent living standard. And in the 2020 survey, we found that the pandemic had left them poorer or even more vulnerable. In other words, it was right that the government assistance reached this group. And it's also important to note that the very wealthy individual, they also rarely participate in a national socio-economic survey such as this. Regarding the small business, we also found that 1 in 3 households, they have small business, and almost 90% of them are affected by the pandemic. There was an important gender difference that was revealed. The percentage of business which has to close down temporarily, it was greater among women-owned business, 7%, than those owned by men or jointly owned. This is because women-owned business are most concentrated in trade, restaurant, and accommodation sectors, which are hit hardest by the COVID-19 and also the public health measures. And at the time of the survey, we found only 7.5% of households with business that had received the cash grant for micro business or BPUM. And it's likely because the program had just launched at the time of the survey. But again, surprisingly, awareness about the government assistance was quite low. Less than 40% were aware that there was special assistance on offer for the small business. What was encouraging, however, is that funds were being used for intended purposes. Around 80% of recipients of the BPUM, they say they use the fund for additional capital, while 12% is for the seed capital. We were also able to inquire what the beneficiary have to say about the social assistance, and the responses were positive. 67% of beneficiaries say that the assistance were helpful, and 73% they preferred assistance in cash. And beneficiary, they use the assistance to buy groceries and other essential items, to pay for the utilities, and also for mobile and internet credit. Hence, given these findings, our recommendation revolve around 6 main areas, which remain relevant today. First one is the need to support children to learn by safely reopening the school once the emergency restrictions are lifted, and support those who are behind to catch up, to stay healthy by minimizing disruption to health services, and to be protected by ensuring mental health support for children and their families are a part of the relief support. Second, the importance to expand food assistance and combat supply disruption to address increased food insecurity, to maintain support to lower and middle class through the social assistance and labor market programs, ensure people with disability can access the health services and treatment that they need and are prioritized for social assistance. Last, recognize and reduce women's care burden through campaigns to promote equal sharing of care work and equipping parents with skill and support that they need to successfully support children to continue learning. So these are the sum of the major highlights of this study. I will now hand it over to Pak Aco to discuss the result and also the process behind this collaboration next. Thank you, Pak Aco.
Thank you, Michelle. It's very good summary. We can already feel that there's a lot of information in the survey. So let's move now to discussion parts. First, I'd like to invite Pak Hidayat Amir from Fiscal Policy Office from BKF to share his view on this study. Welcome, Pak Amir. It's good to see you again. I'd like to ask you first about BKF's role in this survey. What is the role of BKF, and have you used this, the findings of this research?
Yes, thank you, Pak. Thank you, Michelle, for the presentation. I would like to thank UNICEF, UNDP, SMERU, Prospera, and also our colleagues from Statistical Office. We're facing extraordinary time due to the pandemic of COVID-19, and I think our focus when we are facing this kind of condition, of course, first to contain the health problem. So we are a fiscal policy agency as the think tank in the fiscal policy formulation. I think we have a responsible to design a proper policy, to design the proper response on containing the pandemic. So the first, of course, we have to facilitate to support the measure on health problem. Second one, we have to shielding the impact of pandemic. We see that the impact in terms of economic impact, the most vulnerable one is poor and vulnerable household, bottom 40 or maybe more, because in Indonesia, bottom 40 and bottom 60 maybe quite similar feature. So then, we thinking at the time, Pak Aco and friends, of course we have to expedite the measure, the response to shielding them very quickly. So we are thinking that, of course, to do the fast response, we have to use the existing program. And we know that Indonesia still reforming our social protection system. So we at that level, at this level, we still have, of course, we have to thank. We already have unified database on poverty alleviation, but of course this is not ideal this time. But we continue to reforming this one. We have to continue. We have to use the existing one because this is the fastest measure we can do. But we realize that this is not enough. So then we're trying to see another measure. For example, you know very well. We're trying to see the target in terms of household and in decile 1, 2, 3, and 10. So what kind of program that we can address the certain or the target very better. So we use PKH, we use kartu sembako, and then we end up with discount listrik, electricity bill discount, and also some others, employment card and so on. So then, but of course, as a policymaker, we have a question: this is sufficient or not? Even though before the program itself, we still questioning what actually the impact to the economy, what actually the impact of COVID-19 or the pandemic condition to the household, for the poor and vulnerable household. We have to know the information very thoroughly, very detailed, so then we can set up the design of policy response that adequate to shielding them from the pandemic. So when we talk with Ratna, we have long collaboration with Prospera, with Asep, Suryahadi, and so on, all friends, SMERU, UNICEF, UNDP, Prospera. So this is the discussion at that time. So I think conducting the survey, customized survey, not the regular survey, is necessary to see the impact for the first one, and then for the second one, to make a proper design to shielding them from the impact of pandemic. I think this is the background or the motivation to do the survey, and then we have a serial discussion. Of course, this is not only the survey that conducted to Indonesia. We see some others, but how to design and for every survey filling the gap and working together to see better what is the impact of COVID-19 and also what the best response we can do in terms of policy response, in terms of fiscal support to shielding the impact for the poor and vulnerable. And also because we conduct with UNICEF, of course, we have attention with not only with health, not only with poor and vulnerable or income loss, but also with the issue of children, the issue of education, and so on. So this is kind of our discussion at that time to see what kind of survey, what kind of data, what kind of information that we need to make a better policy. I think this is part of our attention to make evidence-based fiscal policy.
And do you think the results of this study, Pak Amir, will continue to be relevant in light of the second wave, if you can call it second wave of the COVID infection?
Sure, Pak Ajo. I will give you an example. Of course, we have an input of the existing cash transfer. What is the impact? What is the benefit for the poor and vulnerable household group? And then we try, for example, at that time, because we have to tackle higher level, higher income group, so we provide, like, for example, what we call it, salary subsidy for the person that have salary below 5 million rupiah and recorded in the BPJS Ketenagakerjaan. We submit it with such kind of subsidy. Of course, as mentioned earlier, if we use the existing program, basically we have a better data. But if we use or we provide or we design new one, so mean we have to find new data, and sometimes new data not being tested first, and based on the result, for example, there is some for the targeting still need to be improved. For example, something like that. So we see that there is a response, there is the information that the policy at the ground what is the impact, so the feedback to the policy, and now we are designing, we are in the second, what we call second wave, basically in the 2021st, we designing better social protection program, responding, of course, with the dynamic of the COVID-19 that still exists in Indonesia.
Great. Thank you, Pa Amir. Maybe last question from me is, what is the government's future expectations, if I may, from the partners involved in this joint study?
Yes, we already discussed with our development partner to continue with the second survey. Basically, the first survey gives our information for us, and then we have to reconfirm and get more information that needed. And of course, for this, for the time being, our focus on navigating the impact of pandemic, trying to see better in the economic recovery, protecting the poor, vulnerable, trying to have a better recovery plan. But for the long-term trajectory, Pak Ajo, of course, this is very, very important to setting up our reform on the social protection program. Michelle already presented that we are facing, of course, there are so many challenges, there are so many room to improve. So, but I think we work with data, we work with better information to design better social protection program, supporting the people, not only during the pandemic, but of course for the future.
Thank you again, Pa Amir. I understand you have another commitment very soon, so thank you for sharing your time with us on behalf of everyone here. We really appreciate your sharing with us today. Thank you, Pa.
Thank you again, everyone. So sorry, I have to leave early. Thank you again.
Okay. Now let's go back to the team. Maybe we can have some discussion on the reports itself. For the first part on the general issue regarding the study, I'd like to ask a question to the team, to the studies team, and that question is, how are you going to use this research to inform the policy, to inform the support that you provide to the government of Indonesia, including through the current second wave? So let me first ask Mbak Ratna maybe to give us some insight about this study on the aspect of this study about children and their families. So over to you, Mbak.
Thank you, Pak Aco, for the questions. Yeah, I think the study itself. I mean, when we plan to carry out this survey, is mainly we want to know what is really going on at the field level, because children are facing disproportionate impact of the pandemic. Yeah, I mean there is a lot of questions addressed to UNICEF, like why don't you just investigate the children, like interviewing directly the children, because this is more typical UNICEF studies. But we also realize that children living with their parents is been terminated from jobs during the pandemic, and their parents is just also got cut off their salary, and cannot teach properly from home, and they should teach the children, and they should do the homeschooling for their children. And if you go more into the detail, like for the parents with the low educational attainment, and also no proper internet connections and no sufficient devices available within the household. At that time, we cannot imagine what children really suffered from. I think we also learned from the case in Sierra Leone when the Ebola breaks happened, and the deaths and the deaths or caused by the pandemic is caused by the Ebola is not that high, but the people who died because of the lockdown and so on is the number is getting impressive. I think UNICEF has done the study on that. So based on that emergency situations, yeah, so we need like to really see the broader spectrum of the children's where they live, and also UNICEF Indonesia, we have programs on social protections. And we have also learned from this study that the cash transfer under for the emergency under the village fund is really does work actually in reaching the most vulnerable groups. I mean, at the beginning when the village fund, the cash transfer under the emergency under the village fund is implemented, everyone's doubt about it, whether it will be a success story or not. But I think this survey also highlights that the community targeting does work, and it could be also as good as the proximity test. We know the latter one is quite expensive in terms of data collections and other sophisticated methods. But during the emergency, community really can work. I mean, to determine the neighbors who cannot eat sufficiently, whether the families has children and they should need support from cash transfer for the emergency under the village fund. So this is very important for our programmatic point of view. This also a lesson learned, I think, for the government, for us as the development partners, how actually, I mean, the emergency relief can be implemented. Yeah, I mean, we know that the village fund is a more demand-driven schemes, but in just a minute it turns to be like more on the top-down social assistance program. So this is the big learning for us in UNICEF to advocate more on social protections. Thank you.
Sorry, Mbak Ratna, sorry to cut you there because there is a very relevant question from Pak Terry Hall on the Q&A box. I see that. He's asking about the role of BKKBN because we were talking about family here and relief. And also he asked if there is any cut to the family planning budget. Do you know any of this?
Yeah, I think we have, I mean, but we don't have study on that in particular issue, but we do, because UNICEF has a field office in 7 provinces across the Indonesia, and we heard from our colleagues who works in child protections cluster and also in a health cluster, the family like submitted complaints to UNICEF so we don't receive any family planning programs anymore. We find difficulties to find the contraceptions, for instance, something like that. Yeah, and so and our child protections cluster is also highlighted the cut of budgets in Dinas of Women Empowerment and Child Protections at the subnational level. Yeah, but but there is no comprehensive study on that. This is only based on the report that we received from our colleagues in the field office.
Okay, thanks, Mbak Ratna. Now let me move to Rima, Mbak Rima from UNDP. Can you tell us about the poor and vulnerable groups?
Yes, thank you, Pak Acho, for the question. So I guess, yeah, the study itself highlight a lot of finding regarding the poor and the vulnerable groups. And this is bring a lot of discussion and also internally for UNDP programming what should be the intervention during this pandemic. We are gladly that be part of this survey And then we are also working collaboratively with UNICEF, with Bappenas to be involved in the process of reformation of the social protection. Like end of last year and the beginning of this year, we are supported Bappenas in improving the DTKS targeting mechanism, as well as we are working on piloting in socio-economic registry that aim to cover 100% population database. Because based on our study, we found that the people who live in the quintile 2, 3, and even probably 4 is also suffer from the pandemic, and some of them might not be captured in the DTKS. Even the DTKS now expanding probably to 60%. And the survey also find some finding that connect us with just not the typical player on the social protection one, Ministry of Finance, Bappenas, but also we can work with Kemenpan RB because they have this national integrated complaining handling system. Now we are trying to include the complaint handling regarding the social assistance targeting and distribution problem, since we still found that like 1/3 of the bottom 40 still not receiving the social protection. So I guess this complaint handling could be top up to whatever system that available now. And this is the way study direct us to have a conversation and an advocacy with the stakeholder. And also some finding that's shared by Michelle on the vulnerable groups like women and people with disability also bring us to have opportunity to discuss more on what kind of policy for unpaid care, something like that, with Ministry of Women Empowerment and Child Protection. So I guess a lot of layer on the study result provide opportunity to us to reach out and then to discuss what kind of comprehensive policy, evidence-based policy for to tackle the problem during the pandemic and then probably the second wave, and as well as for the preparation of the recovery. I think that's what means the study for us and for like our way to communicate with the stakeholder.
All right, thanks. Next, we would like to learn about the impact to business sector. So, Ibu Della, can you brief us on that?
Thank you, Archo. I guess for Prospera, I mean, we've been working with Government of Indonesia, in this case, mostly Minister of Finance, the PAN team, but also the KPC PAN at CMEA to looking at the impact of the pandemic and what kind of policy response. So that started in the beginning of the crisis. But a lot of information we use, the evidence that we use actually from the analysis that happened before the crisis, right? But it was needed in the beginning to be able to come up with policy response, both in the social assistance or social protection context, but also the business impact of the pandemic. So, I mean, we've done another survey also, but I think the goodness, I mean, the value added of the survey is really, this is a national representative survey to the household. So it's kind of like complement. At the beginning of the pandemic, we've done, for example, jointly with World Bank and Bappenas on the business survey, or we have our private sector development and economic inclusion kind of like survey, all done by sort of like a telephone survey, SMS survey. So very quick, kind of like, still nationally representative. So when UNICEF, UNDP, SMERU asked us to join this, I think we think this is a very good opportunity to get a more comprehensive nationally representative survey as well, to complement what we've done and see whether the policy proposals and or policy response that the government has been implement during that period, because the survey happened a bit later in 2020, right? October, November, and we learned about the result in December, is actually sort of like consistent with the findings as well. So it's been very helpful in a sense, and we can check whether the support has been implemented and what kind of support has been helpful. We understand, of course, business, and in Indonesia, of course, the challenge with the business survey, you have the business formal sector, but you have also informal sector that tend to come from household. And this is where the survey is very helpful to understand what is the impact to the household or the household that has the business within sort of like their as their income level. And I think we learned a lot from this, that, you know, which is quite consistent with the other surveys that we did, that the impact is very significant, and then the support need to be more effective in reaching out to this household. And as, for example, Rima mentioned, when we did the social protection analysis with the Minister of Finance and also TNP2K at that time, clearly there is the vulnerable groups that need to be included, and that they, you know, that they also tend to have small businesses. So for example, there's a policy to reach out to these micro small businesses, the BPUM support, for example, that introduced just last 2020 to help with the business. There's also understanding on, you know, how effective is the business survey, the business support, like the subsidy and things like that, but this is beyond this whole survey. So we're looking at those complementarity and understand what's the impact. And I think going forward, this is very helpful as well when we work with the government in this, you know, very challenging situation of the Delta variant, because then this survey also help us understand what kind of social assistance that really needed by household, but also by small businesses. And that's what we've been sort of like using also to understand the impact to the income level, you know, the sort of like what the income loss has been experienced on average by the different level or income of household, what kind of support that they think is very useful and get to the right household, and, you know, what's the gap that is there that may be able to be addressed. So it's all very helpful in a way also, because during this round of, for example, economic restriction, you already have a better information from the previous round. You know, what's the restriction impact to the household and impact to the businesses. So you're a bit more careful in providing the analysis, you know, what can be done in that sense that you know, can help people affiliate the economic consequences, while at the same time we're having a more pressure on the health services, and that's what we try to complement also with this additional survey. I guess that's more or less what we're looking at. But also, since, you know, the surveys also touch the issues like the impact to the children, education, and disabilities, we've been also using this for our future work, you know, ongoing work actually, but the future policy also around what kind, you know, of support or assistance needed for these vulnerable groups as well, that we're doing it currently with Ministry of Finance. So that's maybe some, I mean, a couple of examples that we really use this survey to our work with our government counterparts, and see, you know, how this information or evidence help sharpen some of the policy recommendation. I think most of the respondent, Pak Amir mentioned earlier, that the implement last year is also sort of like really helpful in implementing this year, although as Prima mentioned, we're still in the process of improving the DTKS and everything, but at least we know which one that the government should deliver first, which area that they can deliver first in terms of the support. So prioritization is become important here by using all of this evidence. Of course, now we have the other evidence more comprehensive from the PS for the, you know, Sakernas, Susenas, but at that time when, you know, in 2020 or in the second wave, which is December, January, February, we don't have that information ready. So this kind of survey really helpful to looking at that, because we understand for BPS will require them time to do Sakernas and Susenas properly. So it's really helpful to have all of these tools and analysis in providing our input. Thank you.
Thank you, Della. Before we move to the next part about partnership and the next steps, I see two hands there. Maybe their questions are very relevant to this, what we just discussed. So let me invite Donnie from area and Peter Macaulay, and maybe also Aliza Hunt to give their comments very briefly, please, starting with Donnie.
Can you hear me, Acho?
Yes.
Okay. Thank you, Acho, and thank you, the panelists. Questions to Ibu Rahma. What is the implication of the findings for the protection for children during the later stage of COVID, or maybe even post-COVID? where lockdowns or interruptions to education services can happen at any point of time, randomly, like, for example, like what we are experiencing now. As you know, the government would like to start the, what do you call that, physical, this is for children education. Government would like to start the schooling starting from this June or July, but then everything has to be dropped because of the second wave outbreak. So all of this give, you know, interruptions for children, especially in their educations. And in my view, this could have long-term implication in terms of, you know, their knowledge accumulation, human skill development. So what can the findings say something to protect children in terms of their welfare, especially their access to education? Thank you.
Thank you, Doni. Please hold on to that question. Let me ask Pak Peter first. Peter?
Oh, baiklah, terima kasih. Can you hear me, Pak?
Yes, Pak.
You can hear me. Okay. Maybe my question is to Bu Michelle. I'm not so sure. And let me say sebelumnya, I have opened the report on the web, and I've been looking at your report. It's a very good report. Terima kasih banyak ya. And what I am looking at is the annex of the report. This is pada halaman 51. It's page 51 and so on, which is an overview, a sort of ringkasan, a sort of overview of all of the government assistance programs. 2 points. First of all, this is a very good summary. Terima kasih. I found it very interesting. But second, and this is my main comment, and maaf ya, ini agak tajam. It's not tajam to SMERU, or it's not tajam to the people doing this, but this is really tajam to lembaga internasional, Bank Dunia, United Nations, ADB, dan lain sebagainya. And that is that when I look at the data in Annex 1, the last column yang paling kanan, the cost of emergency response, what is actually yang sangat menonjol, what very striking here, is how small the total of it is as a percentage of GDP. And it seems to me that the role of the international community should not be really to focus so much on the use of this assistance, which is, of course, very important. Saya setuju sekali, it's very important. But the real message here is that both in Indonesia and in many other developing countries, unfortunately, the total amount of assistance for the vulnerable groups, yang rentan, group yang rentan, the support for vulnerable groups is actually very small, especially in comparison to what is happening in the first world, in the rich world. We have a very sharp difference. And again, this data, if you look at the data in Annex 1, saya terkejut ya, when you look at the data, what is striking is how small it is. Now that's an overall comment. Yeah, this is an overall economist comment, and actually I am critical of the World Bank and ADB and UN and so on. Our message, the message of the international community should be that certainly good targeting is needed, but what is really needed is much more assistance. Now, barangkali tidak setuju dengan saya. Maybe you think I'm wrong.
Okay,
so I guess, yeah, my last question is there room for more assistance? Terima kasih ya.
Thank you, Peter. Last one, Aliza.
Terima kasih banyak, Mas Archo, and thank you very much to all speakers. That was really an informative presentation. I was just having a bit of a discussion, I think, on the question and answer with Michelle. Thank you very much for clarifying a little bit in terms about how you define disability. I'm just interested because we see a lot in depictions, particularly in Indonesia, of disability being represented by someone in a wheelchair, and of course we know that it's far more than that. And I can see from the report, looking in detail as you've directed me, that you've basically disability is being measured as per the Susana categories. However, I do have a bit of a concern about use of asking people directly whether there is someone in the household that has behavioural or emotional problems because of the high level of stigma that's associated with disclosing that type of information. So I'm wondering whether or not you might have, and I know that this is an existing SISNUS question, so you may not have done any field testing around this, but I'm wondering if you do have any information around the numbers of people that were responding positively and saying, yes, there was someone in the household that had a behavioural emotional problem compared to the other types of categories of disability that were being asked about under that item. I wonder if you've got any more information, because there is a concern often that mental disorders are not really being represented and are absent from a lot of this data. And I'm wondering if you could comment on that, please.
Thank you, Eliza. Maybe quick response to these questions. Maybe Michelle first, you have 2 questions there. So can you briefly respond to them?
Yeah, and maybe the others can also compliment me for the first for the Pak Peter. Yes, Pak, I agree with you. Yeah, it's a very very thankful you point that about how small the percentage is, but yeah, but I will let the other to complement my answer. For Miss Aliza, yeah, I think I need time to check the Excel first, and I will answer it in the Q&A if you don't mind.
Okay, Mbak Ratna, there was a question from Doni about protection for children.
Okay, thank you for the questions. I think this is very related with UNICEF classical interventions programs. Yeah, actually from the education's point of view, I think we are encouraged the simplifications of the curriculums, especially at the early childhood age, because the learning loss is most likely happen at the age 5 to 12 years old, and this is really concerning. Because this is the time when children acquires the cognitive skills. So we actually been advocating Ministry of Education to do the reform right now, to simplify the curriculum. So it could be more simpler for any education background of the parents. Even if the community without a sufficient education level can also carry out the remote learning, and yeah, I think that's the problem. I mean, UNICEF is strongly encourage children to get back to school as soon as possible, and yeah, and also get the teacher get vaccinated fully, and also all the worker in the school, and with the proper wash systems and all the health measurements. But I think simplifications in curriculum, and also the more user-friendly teaching materials that can be provided through the radio, for instance, not necessarily through the internet. And I mean, so the least skilled teachers can also can reach more children. I think that's one. The other thing is that we heard and we received some information. Of course, this is not a survey. This is the qualitative information that we receive from our NGO partners. Is many children are now left by the parents who died because of the COVID-19. That they live with the grandparents and already in poor condition. So this is the time that we do need social protection, social assistance programs that directly targeting children, so they can get a proper protection, economically speaking, no matter which family they are live with. I think that's all, Pak Aco. Thank you.
Thanks, Mbak Ratna. Now, while you have the microphone, let me continue to the next question and the next part. Why was this nationally representative survey on socio-economic effects needed? Can you tell us about it?
Is it directed to me?
Or Mbak Della, maybe.
Okay.
All right. I guess I touched on that a little bit before, Pak Aco. I think it's important to have this to be able to have the stronger evidence available that representative across the country, but at a household level as well. Most of the survey, I mean, certainly this is to complement others. Our bank also have their household survey. For example, we have our business survey and sort of like other quick sort of like high frequency survey. But this one really is using a different methodology, which is a face-to-face also interaction. So, I mean, in that sense, it gives a richer data to look at some of the information and questions that you have. And it does have additional models looking at the vulnerability group. So I think that's where this survey has been very helpful in that sense. While I think we're touching on this, can I respond to a couple of questions that Pak Peter and
yeah, sure.
Actually is important. Pak Peter, I think of course we agree with you, but of course and as well as the pandemic tell us that it's very. This is a struggling situation for emerging economies. On average, emerging economies can only provide 5% of GDP in terms of the pandemic support, while of course, advanced economy can go on average of 25% of their GDP. But this is a longer term issues. I mean, for Indonesia, for example, that's of course our longer term issues on the fiscal, the revenue, and the type of other issues that I think we need to address to be able to increase some of the spending that's important. But I think the government has been taking that into account, the vulnerable groups that you mentioned, and looking at the ways to support them and include them in the broader social protection reform. Just a bit on Donnie's comment, which I think is very important areas as well, as I think we work with other partners in this education policy. I mean, this is not a Prospera sort of like areas of support. We're looking at more from the fiscal angle, but of course we learned that the partners, even SMERU, I guess, is now working on the learning loss, with other partners like Tanoto Foundation, WVI, for example. So really, I think there's been a follow-up work on this important topic on the education, and we'll continue looking at that and feedback to, in our case, how the education spending can be more effective going forward, because we've been working in that space with Ministry of Finance, looking at, of course, this 20% spending, how it become more effective. And of course, the pandemic create a lot of issues in terms of the possibility of learning loss and other disruption in the health and education services. So I think we hope to see more evidence on that going forward, and hopefully can answer your question later on. Thank you, Acho.
Thanks. Now I want to listen from Rima about the challenges that you guys had when administering this survey. Maybe about the logistics of managing face-to-face survey, the timing of the survey, and so forth. Rima?
Yes, thank you, Pak Acho, for the question. So when we start the survey, it's UNDP and UNICEF, we plan to do this survey through IVR. IVR is interactive voice response, so by phone basically. But the challenge is we want to have national representative data. So it should be using Susenas, and Susenas doesn't collect the phone number. So at that time, we are thinking to hire BPS enumerator just to collect the phone number and then do the survey through IVR, because we think that would be a safer solution for that. But because using about phone number, like phone survey or IVR, the response rate typically very low. So we decided it should be face-to-face, and we have a lot of questions. So the constraint is because of the face-to-face. So we have to maintain the safe protocol. At the same time, we want to address a lot of issues, a lot of questions. So we try to balance that at the result. So there's so many questions in Susenas that having layer, household level, individual level. So we don't ask the individual level. We just focus on the household, because we are thinking that, maximum our survey will be 30 minutes. So the logistic itself also, we have to have a hybrid between online training but face-to-face data collection. So I think this is like a lot of partner, a lot of engagement, really helpful because there's a lot of support that we receive, particularly from BPS. And the second challenge is also about the timing, because at that time, BPS is managing two big survey, the national census and also the Susenas. So we are planning to use their enumerator. So the timing should be fit with the schedule. So yeah, and then finally it's worked out. So we do after the Susanas September finish. So that's kind of challenge that we are continuously try to solve. So maybe the survey is like not really like perfect because it not accommodate all the concern, like everybody has like different concern, different question, but this is the best that we can do given the time and the constraint having this health protocol limit. And maybe Ratna could add, because this is something that actually UNICEF and UNDP do since the beginning.
Yeah, Ratna?
Okay, I think Rima already told everything about the challenges with the survey. And yeah, I think the support from Statistic Indonesia or BPS is quite critical because we also want to see the changes, the impact from 2019 to 2020. And yeah, it's also challenging to collect the phone numbers of the respondents. I think this is the first time BPS has this kind of data set. And we also like UNICEF because we do have like huge programs on emergency. Our concern is mainly how to reach households in the absence of proper infrastructure or something like that. So I think we in this case we also like support BPS and also provide an alternative for the Statistics Indonesia when disaster hits, the pandemic, the flood, earthquake. Perhaps they can like give a quick call, and trying to grasp information as soon as possible from the victim, from the beneficiaries, and from the respondent. I think. Yeah.
Okay, sorry to ask this. Why do you have to do this together? There's UNDP, there is UNICEF, there is SMERU, there is Prospera. So what has been the value added of doing this work together rather than separately? Maybe Della first?
Yeah, I think clearly this is a massive undertaking, Acho. For example, when we did the business survey, I mean, we're dealing with, I don't know, thousands of companies, but we start with, for example, the economic, the business registry from BPS. Has been a lot of work. So can you imagine doing it for the whole household with the, national representative across Indonesia? So I think it's, I mean, we certainly see that value added doing it together with the partners like UNICEF, UNDP, and SMERU in that sense, because I think it's a big task, a big job, and also the face-to-face survey. I mean, it's better to do it together because you combine your resource. You avoid the survey fatigue from respondent. I think there's another issues, of course, when we do our survey, either is business or household, that using even the telephone or the SMS or the online, it's sort of like you need to understand that, they've also received many other requests. So it's good if partners join together collaboratively with combined resource and really do it together. And as Prima and Ratna mentioned earlier, this is a very challenging task, even to create the sampling framework and everything. Is a lot of tasks, I guess. So we're really happy to do it together, and that's why I think that the value added. And also you kind of like add the nuance of the result of the survey from different partners, because then you understand from different angle, other areas, the impact of the pandemic, and really enrich your discussion on the policy with government counterpart, some areas that you may not see it before, coming from different angle. I think for us, that was sort of like the really value added of the survey. So, and, also we can discuss it, like what's really the advice here? What are the policy, looking at the various element of the impact, so you don't come with a, sometimes it may not be contradictory message, but it's just, like, because you haven't discussed it, but having a different groups, understanding different angle really help us enrich the quality of the policy advice that you can give to the government. I guess that's the important part. And I think, you know, for example, in one of our work, you know, we've just sort of like working a bit more on these issues around early childhood education and others, and really enriched by our partners in this survey to understand a bit more and take that into, you know, our policy areas, which is sort of like tend to be more from the economic fiscal policy angle, but understand the other point of view. So I think that's been very benefit
Great.
that we can do. Thank you.
Prima, Ratna, Michelle, or even Pak Asep, if you want to add.
Yeah, I think echoing to Ibu Della, the report itself, like, because this is working together, so it's shaped that we can advising our stakeholder into more holistic. For example, UNDP, typically we work on the vulnerable group, but focusing on women and disability, but we don't really work on children. But working together with UNICEF, we are understanding about more the challenge of the children that which actually could fit more on our program or our advice, so it could be more comprehensive. That one side. The second is, of course, like same like Bu Della said, it's about more resource in terms of in terms of because the sharing cost and also the sharing work is really work. And the last one is, I think the one of the most important is each of us has the same stakeholder, but we have a kind of different stakeholder as well. So this is opportunity to reach more. Like I said, the study for UNDP is not like just for support the common stakeholder, so finance, Bapenas, but also to reach to other ministry that actually work also on the COVID situation. So I guess that's the beauty of this collaboration.
Thanks. Let's now move to the question and answer session again. Let me invite three people to ask their questions, and they are first Ibu Dini Yusuf, then Pak Budi Resosudarmo, and then Jeffrey Nelson. Ibu Dini?
Yeah, thank you so much. Thank you so much for this very useful report that we really need in this time. My question is, what is your worst case scenario if this pandemic continues for various reasons? For example, for new variants and then government budget, which is like depleting. And also, what are the suggested solutions that you could think of based on the research or the survey that you have done? Just high level. I just want to get some pencerahan. Thank you very much.
Thank you, Ibu. Pak Budi?
Thank you very much for presenters presenting an interesting survey. So I quickly look at the summary of the survey, and it seemed to me that the main issue that trying to tackle is on this effectiveness of targeting, but meaning that whether the poor receive it, the social safety net or not. But it seemed to me there is not much discussion whether or not by receiving this social target, the poor actually could change their behavior that could follow health protocol. We already know that the health protocol is important, although you could, although the poor receiving the social safety net, but if they keep doing what they did, then the pandemic is still there, and there is an issue in terms of reducing the size of the pandemic. So that's number one. So second is that if, for example, the data show that all the social safety net has not changed the behavior of people so that they could actually follow the health protocol better, should we actually start thinking about conditional social support, meaning that, well, we give, so in addition, so this is not substitute, but in addition of the basic social support, we're going to give you social support, but you should blah, blah, blah. But you should basically following the health protocol. Thank you.
Thank you, Mas Budi. Last but not least, Jeff Nielsen. Jeff?
Yeah, thanks, Archo, and thanks to the fantastic presentations. I think my question may be best answered by Pak Asep, although others might want to answer it. Obviously, this particular study has given us a lot more nuance than some of the broader surveys on the impacts on the most vulnerable. But I guess my question is perhaps at the broader level. And my understanding is that the poverty rates are not quite as low as what many of us predicted perhaps a year ago. And given that the overall contraction in the economy, which we obviously associate with increases in poverty, it seems that we've had this contraction of the economy, but poverty is not quite as high, as bad as it has been. The poverty rates don't seem to be quite as high as we predicted. So I guess my question is this a surprise? And are we sort of confident now to say that, therefore, we had a successful implementation of the social protection payments? So thank you.
Thanks, Jeff. Before going back to the panel, let me read that question from Pak Richard Borsuk, because it's very similar to what was raised by Jeff. Pak Richard Borsuk asked, is there any way to compare the impact on households from COVID with the impact on them from the 1997-98 Asian financial crisis? The economy shrank 13% in that time, 1998, and only 2.1% now, 2020. But that doesn't tell us about the real impact on households across the country. So I think it's similar question. Okay, so back to the panel. Who wants to go first?
May I?
Okay, sure. Mbak Ratna.
Yeah. I think I would like to respond to Pak Budi questions regarding the social assistance. I think it's, this is, UN is strongly advocating social protections as a basic human right. So regardless any conditions, the economic always going up, going down, recessions, and then normal again, and then times to collect the benefits of the growth. It always happening, but UN is very strongly advocate for unconditional and universal social protections because this is resilience that can be be provided to people, so they are sure that if they cannot earn income, they cannot go out to the street to sell the goods, they can still eat, the basic food, and also to not to live like in a proper or decent house, but they can still at least eat 3 times a day. So yeah, I think it's very. I think the question is very interesting to conduct the next study on that, and yeah, I think we are very keen because I think all of us are keen to conduct the second round of the survey, and yeah, we can also explore that basic research questions on the changes behavior, whether people will stay at home if the government provided sufficient amount of the money to them. Yeah, but I mean, we know that the amount of the social assistance itself is really small. It's only like 300,000 rupiah gitu ya. And I'm just wondering in how many days that the low income groups will spend this money. Yeah. So I think this also our concern. Thank you.
Thank you. Della?
Yeah, just to add on Ratna's response, I guess I think I really understand Pak Budi's concern and agree that's an important area where the government needs to have an intervention to improve behavior. But I think, as we know, now the government step up the social assistance again, following the pattern of last year, early this year, which has become 500,000 per household. But we learned from our study, the evidence showed that the income loss on average of the household is around 1.2 million rupiah. So it's way below their need, basically their basic needs. So that's the challenge. And I think to put conditional around that is also required some kind of monitoring and evidence. So, but I think I get the point. But I think it's an important to how the government, in this case, whether it's local government, also help address the behavioral issues, and that's what they're monitor. For example, we've done a survey jointly with Ministry of Health on the vaccination behavior, for example. So they've tried to see how that would improve over the time. Also, for example, this wave actually tell the government that the tracing and tracking is very important, and there should be massively more effort put toward that. In addition to the preparing the health services, I guess that's the angle or the direction. On Ibu Dini's question, I think, I mean, you know, of course, this is an unprecedented time. The pandemic is very hard to predict the worst case scenario, but I think together with government, we're looking at some of those potential impact or the risk to the economy for the country like Indonesia. The challenge, of course, you know, as we have massive informal sectors and other things, it's very hard to put a lot of restriction, but during this wave of pandemic, for example, government monitor very closely across district level, not only at the province level, but also across district level, how the reduction in mobility happening, you know, why it's being challenging, for example, in some areas, and what's the issues there, and how to address that, you know, to understand that also mindful that the people may also be fatigued in that sense, and it's the choice between, you know, whether you can eat or you know, you have to suffer because of the pandemic. So I think they're looking at a bit more detailed evidence at that level to be able to anticipate and provide policy response because it's very sensitive, sort of like a challenging topic as well, how you balance between the health need and also the economic and all the need of the people going forward. But I think as long as that's balance can be found, the government may be able to continue to manage this within the challenging situation, the fiscal situation, and other things that the government need to address going forward. You know, and I think as they learn toward this, at least now the second big wave, actually, hopefully there is more knowledge and tools available if it's become worse, or if there is another wave coming, how to deal with that and how to provide response at a more granular level, I guess. I think on Pak Jeffrey's, Pak Asep may be able to answer more. I think it's quite challenging, but maybe possible to do, Pak Asep.
Asep, do you want to comment? You're on mute, Pak Asep. Yeah.
Yeah. Thank you, Pak Acho and Jeff, for the question. Indeed, that's very intriguing, yeah, because we included as those who originally predicted that the poverty rate will increase by much higher than what the official statistics have shown. So now we are doing a study trying to account for how much was the increase in poverty due to COVID, and how much is the reduction in the increase due to the social protection program. Yeah. I hope we will be able to answer your question quantitatively soon. Yeah, with the result of our new study. Yeah, but I think that's our hypothesis for now, that the social protection program play a role in dampening the increase in poverty. And related to Pak Richard Borsu's question, I think the main difference is with the 97-98, which is that, yeah, in 97-98, we were practically unprepared to face the social impact of the crisis. But now I think Indonesia is much prepared, yeah. So when the crisis occurred, the government very quickly roll out and expanded the social protection program. I think that's the short answer, Pak.
Thank you, Pak Asep. Let's now move to the next round. Let me invite 3 other questions, and that's from Pak Terry Hall, Bu Farida Indriani, and Pak Fadil Hassan. Pak Terry, can you go first?
Thank you very much. This is a fascinating presentation of the survey and also an overview of statistics in this very difficult time. My question really is about the difficulty of collecting statistics during a time of pandemic. We know that the 2020 census finances were severely reduced in order to free money for the help that the government needed to give directly to households. And that meant that many of the plans of the census, the questions to be asked and the households to be covered were restricted. Then the 2021 sample census has now been delayed until either next year or the year after. So we really have no full count of the Indonesian population for 2020. And I'm wondering how this will affect researchers who are hoping to use census data for drawing samples, but also to set a standard for their critical review of the data quality of BPS and Department Dalam Negeri. So could you let us know what problems you experience in trying to obtain the BPS and Dalam Negeri data that you need for the household analysis you're undertaking? Thank you.
Thank you. Thank you, Pak Terry. Bu Farida.
Selamat pagi. Good morning. You can hear my voice?
Yes. Can you speak louder a bit?
Yeah, bisa. Sorry, a little bit. I'm not. I have a question, but I need the information about the result of the research because I'm late to join. So maybe the narasumber can share the link for me and my organization, Safari Bumi Daya, to know the result of the results.
Okay. I think we have provided the link to the report somewhere there. You can also access the link. Next is Pak Fadil.
Yeah, thank you very much. I have a question for Pak Asep Suryahadi. And then the question is whether there is any regional differences in terms of the impact of the social assistance given by the government, and also in terms of the effectiveness of the various social protection in the region.
Okay, I think if I remember correctly what you're saying, the regional variation, regional differences in the survey. Okay, let me go back to the panel. Who wants to tackle these questions first? Rima, maybe?
I think for the BPS, I think UNICEF is more because the one who like work directly with BPS is UNICEF.
Okay, Mbak Ratna.
I don't have any like yeah, I think all colleagues here can also respond to these questions. Yeah, I think we know that the population census, the specific questionnaire will be delayed until next year or even in the next 2 years. And Bappenas and BPS also has requested UNICEF to support this. Yeah, I think we are thinking actually. I mean, this is also can be answered by all colleagues here. how we can combine perhaps the upcoming second round survey with this specific questionnaires from the population census, so that we can have a clearer or a more provide more comprehensive data from the supply side of the social services. I think that's all. I mean, I think we need to finalize all these research questions, research design for the second round, and yeah, I think and also to need to estimate the budgets. I mean, to pick the most important questions that really can be useful for the decisions maker to to make decisions on the social protections, on the health facilities, on things like that. Yeah, I think UNDP Prospera also collect more many informations on that. I think this is the time again, to really pick up the best questions for the best response. Yeah.
Okay.
Thank you.
Other panelists, anybody wants to add?
Yeah, I think, I mean, not adding much, I guess, Acho, but understand this situation is very challenging, including, I think, a challenge for us for the second round, if it's going forward, is with the limitation of the face-to-face survey, because the pandemic situation. I think we need to take into account of that. I mean, we've had, for example, work, for example, also with Bapenas that would require that kind of approach, but it's very challenging. Even with with partners that doing the survey itself, we have to be very cautious about doing that during the pandemic. And I think that's what the challenge from BPS side as well. And I mean, with ABS partnership as well, for example, BPS has this try to do the online survey, right? But of course, as we know, the coverage of that may be still limited. I mean, in Indonesia, in ways, still need to also improve our digital infrastructures and things like that. But it's I mean, they've launched it, they've tried it, and I mean, I think in a way it was went quite well, but maybe the proportion is not as big as the face-to-face kind of like survey that the census usually delivered. So that's a challenge that I think just have to face and take that into account. I mean, yeah. Not much I can add in that sense, I guess. We face the similar issues.
All right. Thank you. In the remaining 4 minutes, I'd like to know about the next step of this collaboration. And for that, I'd like to ask this specific question first to Pak Asep.
Okay, Pak Acho, thank you. But before going to the next step, I think we would like also to inform you that after we did the survey in October, November 2020, we did 3 rounds of follow-up survey using the interactive voice response or IVR method in January and February 2021 with an interval of 2 weeks between each round. We are working on the report of that follow-up survey, and hopefully it will be released soon. Yeah. But as a highlight, if I can remind you that during the earlier months of this year, the general macroeconomic condition was actually improving. Yeah. But from our follow-up survey, we found that actually the conditions of the poor and vulnerable household was not yet giving signs of improvement. So it seems that the implications that when the economy recovers, the poor and the vulnerable will recover last. So it means that when the economy starts to recover, we should not withdraw the social assistance program too soon, yeah, because it will hurt the poor and vulnerable household. Another one, Bu Ratna and Bu Della already mentioned that we are planning now to have another full round of the face-to-face survey this year, perhaps nearing the end of the year. hopefully it will materialize, and we need the support of everybody, in order to do this difficult undertaking. I think that's from me, Pak Acho.
Thank you so much, Pak Asep. With that, we also just reached our time. So thank you again for sharing this very important survey, and we look forward to the next round of, please disseminate the results also here in this forum, so our audience also know what is the follow-up on the situation in the field. So again, thank you so much for everyone from SMERU, from UNDP, Prospera, from UNICEF, and also for the participants. Apologize if your questions are not taken this time because of time limitation, but we will make sure that we will forward those remaining questions to the panelists as feedback for them. So with that, thank you so much. And then I will return this to Nuka.
Thank you, Acho. I just want to say that thank you. And next week we will have Pak Ono Purbo, our leading cybersecurity expert, who will talk about cybersecurity in Indonesia. And we look forward to having you next week. Thank you to our panelists and participants. And I'm going to close this.
Thank you.
Stay healthy, please.